This video is about vaccines and diabetes. Having diabetes affects your immune system, so it's important to get vaccines because having diabetes can cause you to become more seriously ill if you get an infection. The flu shot is given one time each year, September to June. It takes about 2 weeks to build antibodies, and there's a high dose for 65 years and older. Certain vaccine brands are okay if you have an egg allergy. The flu is a viral illness that causes cough, fatigue, and high fever. People with risk factors such as diabetes can become seriously ill and even be hospitalized. The flu shot will help protect against severe illness. The shot is given one time a year in your upper arm. The pneumonia vaccine is recommended for adults 19 through 64 with a health condition such as diabetes and adults 65 years and older. The newest guidelines recommend the pneumonia vaccine for all adults. This wasn't always the case. It was previously 65 and older. There are several different types of pneumonia vaccine. The newest ones are PCV 15 and PCV 20. Even if you've been vaccinated before, you may be eligible to get an updated vaccine. The pneumonia vaccine schedule varies depending on your previous shots, but for people who are not vaccinated, one dose of PCV 20 or PCV 15 is the current recommendation. Pneumonia can be viral or bacterial, and symptoms include cough, difficulty breathing, fever, and severe disease can lead to respiratory failure. RSV is a viral illness that causes cold-like symptoms. Most people recover in a couple of weeks, but children and older adults can become severely ill. The current guidelines recommend only one dose of the RSV vaccine for people ages 60 to 74 with a chronic condition and everyone 75 and older. Tdap is a vaccine that's in the traditional childhood vaccine series. Pertussis, or the whooping cough, has become more common, and keeping vaccines up to date will prevent illness. You should get a booster every 10 years. Varicella, or the shingles vaccine, is recommended for all adults 50 and older. It's given as a two-shot series. Shingles is caused by a reactivation of the varicella virus. That's the same virus that causes chickenpox. Shingles causes a painful, itching, burning rash following the path of the nerve. If not treated early, the pain from shingles can be permanent. And finally, the COVID vaccine. There's a lot of recommendations and a lot of misinformation about this, but they do recommend people with chronic conditions get the vaccine. Guidelines regarding this vaccine are changing frequently. There is a 2024-2025 updated version, so check the CDC website for the most current information. And most importantly, stay healthy.